In the world of medicine, you sometimes come across drugs that are just full of contradictions. Today, we're diving into one of the most fascinating, neostigmine. It's an absolute lifesaver in the operating room. But here's the twist. Its greatest strength is also its biggest danger.
Okay, just picture this for a second. It's a high-stakes situation. A patient is on the operating table, and for the surgery to even be possible, their muscles have to be completely paralyzed. It's totally necessary. But once the surgery's over, that's when the real pressure starts. You've got to switch them back on, and you've got to do it fast and without a hitch. So, how do you do it? Well, that's where our drug of the day comes in.
So here's our game plan. We'll start with its main gig in the OR, then get into the nitty-gritty science of how it actually works. After that, we'll look at what else it's used for, the not-so-great side of it, and finally, how doctors manage that tricky balancing act to use it safely.
All right, let's jump right in. First up, neostigmine's #1 job. It's bread and butter in the world of anesthesiology, waking up muscles after they've been intentionally put on standby. So, during a lot of big surgeries, the anesthesiologist will give the patient a drug, something like rocuronium. What this does is it basically hits the pause button on the signals going from the nerves to the muscles. This creates a temporary paralysis, and that is absolutely crucial. It keeps the patient perfectly still so the surgeon can do their job without any unexpected movements.
But obviously, you can't just leave a patient paralyzed, right? The surgery's done, they need to start breathing on their own again, they need to wake up. And that's the moment. This is where neostigmine enters the scene and basically saves the day. Okay, so how does it pull off this incredible trick? It seems like magic, but it's pure science. To really get what neostigmine does, we have to first take a quick look at the normal conversation that happens between your nerves and your muscles. Normally, it's this really elegant, super efficient process. Think of it like this. A nerve wants to send a message. It releases this little chemical messenger called acetylcholine. We'll just call it ACH. The ACH floats across a tiny gap and docks onto the muscle, telling it, hey, contract. But you don't want that muscle to stay contracted forever, right? So this cleanup enzyme, called acetylcholinesterase, or ACHE, comes in and immediately gets rid of the ACH. Message delivered, job done, signal over. It's an amazing system, super fast and efficient. But what happens when there's a problem? After surgery, you've got those paralytic drugs that are literally blocking the ACH from docking. And in some diseases, the signal is just, well, it's too weak from the get-go. The message is getting garbled, or it's just a whisper when it needs to be a shout. And this right here is neostigmine's whole reason for being. It's what we call an acetylcholinesterase inhibitor. Fancy name, simple job. Its one and only mission is to stop that cleanup crew, the ACHE enzyme, from doing its work. So let's rerun that scenario, but this time with neostigmine on board. The nerve sends its message, ACH gets released. But wait, the cleanup crew is on a coffee break thanks to neostigmine. So what happens? All that ACH just starts to build up in the gap. It keeps hammering on the muscle's receptors. The signal goes from a whisper to a roar. It gets stronger, it lasts longer, and it's powerful enough to completely overpower those paralytic drugs. But turning muscles back on after surgery isn't the only trick up its sleeve. I mean, this ability to basically turn up the volume on the body's own signals, that makes it super useful for a whole bunch of other things. Yeah, outside of the operating room, it's a key player in treating a really tough autoimmune disease called Myasthenia Gravis. And it's also used to, kind of jumpstart the bladder or the intestines after an operation when they get a little sluggish. Let's zoom in on Myasthenia Gravis for a second. This is a condition where your own immune system goes rogue and starts destroying those docking stations, the receptors for ACH on your muscles. So you have fewer places for the message to land. That means a weaker signal, which leads to some serious muscle weakness and fatigue. So what neostigmine does is it floods the area with more messenger molecules, more ACH, which gives them a better chance of finding one of the few remaining receptors. It helps make up for the deficit and brings back some of that muscle strength. Okay, so far, neostigmine sounds amazing, right? A total game changer. But remember what I said at the beginning? Its greatest strength is also its biggest danger. See, the problem is it can't pick and choose. It doesn't just amplify the signals going to your arm and leg muscles. It turns up the volume everywhere. And all of its side effects are just a logical result of what it does. You get too much signal going to the heart, it can slow it down to a dangerous level. Too much signal to your digestive system,
Hello, cramps and diarrhea. It also makes you produce way more saliva and other secretions. You can even get muscle twitching. And here's the really crazy part. It can cause the exact same problem it's supposed to fix: weakness. Yeah, this state of complete system overload, of total overstimulation, has a specific name. It's called a cholinergic crisis. It's basically what happens when your body is just drowning in too much acetylcholine. And this creates an absolute nightmare scenario for doctors. Imagine a patient with myasthenia gravis comes in, and they're incredibly weak. The question is, why? Is it because their disease is getting worse and they have too little signal, a myasthenic crisis? Or is it because their neostigmine dose is too high and they have too much signal, a cholinergic crisis? The main symptom, weakness, is exactly the same, but the treatments couldn't be more different. One requires more of the drug, the other requires stopping it. You get it wrong, and it's a disaster.
So that brings us to the million-dollar question, really the whole point of this. How on earth do clinicians wield this incredibly powerful but potentially dangerous tool safely every single day? Well, the secret is neostigmine is not a solo act. It almost never works alone. It's got a sidekick, a crucial partner that helps keep all those widespread effects in check. And this is just a brilliant solution. Check it out. Neostigmine comes in and does exactly what you want it to do with the muscles. It reverses the paralysis. That's a big check mark. But it also causes all those unwanted side effects on your organs, slowing the heart and so on. That's a big X. So what do? You give it alongside another drug, like atropine. Atropine's job is to run interference. It goes to those organs and blocks neostigmine's unwanted effects, like preventing the slow heart rate. But, and this is the genius part, it leaves the good stuff happening at the muscles completely alone. It's a perfect partnership.
There are just a few other key safety points to keep in mind. For one, neostigmine has a chemical charge, which basically means it can't get past the bouncer at the door of your brain, the blood-brain barrier. That's a really good thing, because it means very few side effects on the brain. On the other hand, it's the kidneys that get rid of it, so for anyone with kidney problems, the dose has to be tweaked very, very carefully. And lastly, because it can tighten up the airways, you have to be super cautious using it with anyone who has asthma. And so, we're back where we started, with this amazing paradox. We have a drug that, in high doses, can actually cause profound weakness. And yet, it's one of our very best tools for treating weakness. Mastering this isn't just about chemistry. It's about understanding balance, precision, and the elegant and sometimes tricky way we can intervene in the body's most intricate systems.